Chronic obstructive pulmonary disease, COPD, and asthma are two prevalent respiratory conditions that affect the airways and breathing. COPD typically manifests with symptoms such as persistent coughing, production of mucus, wheezing, shortness of breath, and difficulty performing physical activities, often occurring in middle-aged or older individuals who have a history of smoking. Asthma, on the other hand, is characterized by episodes of wheezing, chest tightness, shortness of breath, and coughing that vary over time in intensity and can be triggered by allergens, exercise, or cold air, often starting in childhood. Treatments for both diseases include the use of inhalers to open up the airways, but COPD may also require additional therapy like oxygen supplementation or pulmonary rehabilitation, while asthma management often involves avoiding triggers and using anti-inflammatory medications. A primary risk factor for COPD is a history of long-term smoking, whereas asthma risks can be linked to genetic predisposition, environmental factors, and allergen exposure. Here's a more in-depth look at the detailed aspects of COPD versus asthma symptoms, helping to distinguish between these two chronic respiratory diseases. Affected areas: alveoli, pneumonia, versus bronchi, bronchitis. Affected areas in respiratory diseases are critical for correct diagnosis and treatment. In pneumonia, the infection inflames the alveoli, the tiny air sacs in the lungs where oxygen and carbon dioxide exchange occurs. This inflammation leads to the alveoli filling with fluid or pus, causing breathing difficulties, coughing, fever, and chills. Conversely, bronchitis affects the larger air passages that carry air into the lungs. Inflammation here leads to a persistent cough that may produce mucus, wheezing, and a feeling of tightness in the chest. Understanding whether an infection is in the alveoli or bronchi is paramount since treatment strategies differ significantly. Antibiotics may be essential in bacterial pneumonia, while bronchitis often requires a focus on relieving symptoms and may not benefit from antibiotics if it's viral in origin. Infectious nature, typically bacterial or viral, pneumonia versus viral or bacterial, bronchitis. Chronic obstructive pulmonary disease, COPD, and asthma are respiratory conditions that can present with similar symptoms such as chronic cough, wheezing, and shortness of breath. However, asthma often includes a strong allergic component, with symptoms that fluctuate in severity and can be triggered by environmental factors like pollen, dust, or smoke. Conversely, COPD is characterized by persistent respiratory symptoms and airflow limitation due to airway and/or alveolar abnormalities, often caused by significant exposure to noxious particles or gases, especially from smoking. Unlike asthma, COPD is usually progressive, with symptoms worsen over time. Asthma attacks can often be reversed with medication, whereas the damage from COPD is more irreversible and progressive. Distinguishing between them is crucial as it affects the long-term management and therapeutic approach for the patient. Symptom duration: prolonged illness, pneumonia, versus shorter duration, bronchitis. When distinguishing between COPD, chronic obstructive pulmonary disease, and asthma based on symptom duration, it's crucial to note the chronic, slowly progressive nature of COPD. Unlike asthma, where symptoms such as wheezing, chest tightness, and shortness of breath can fluctuate and are often reversible either spontaneously or with treatment, COPD symptoms persistently impair airflow and worsen over time. COPD patients typically experience a steady decline in respiratory function, with acute exacerbations that may be precipitated by infections or environmental pollutants. Asthma symptoms, on the other hand, are generally episodic, with clear periods of relief, and can vary significantly from one individual to another in both severity and duration. Fever presence: high fever common, pneumonia, versus low or no fever, bronchitis. When discerning between pneumonia and bronchitis, a key symptom to consider is the presence and severity of fever. Pneumonia often presents with a high fever, indicating a more serious infection that affects the air sacs in the lungs and can be caused by various organisms, including bacteria, viruses, and fungi. The body's high-temperature response is part of its defense mechanism against these pathogens. On the other hand, bronchitis, which involves inflammation of the bronchial tubes, typically features a lower-grade fever or none at all, reflecting its generally less severe nature, often caused by a viral infection or as a result of chronic irritation. breathing difficulty, severe impairment pneumonia versus less severe impairment bronchitis. Chronic obstructive pulmonary disease, COPD, and asthma are both respiratory conditions that can cause symptoms like shortness of breath, coughing, and wheezing. However, their symptom patterns differ. COPD is characterized by a gradual worsening of airflow obstruction and is typically associated with a persistent, productive cough. It often affects older adults, especially those with a history of smoking. On the other hand, asthma symptoms can vary in intensity over time, with periods of relative normalcy and acute exacerbations often triggered by environmental factors such as allergens or cold air. In differentiating between severe impairments such as pneumonia and less severe cases such as bronchitis, the extent and sudden onset of symptoms are key. Pneumonia, an infection of the lung tissue, typically presents with high fever, chills, and a cough producing discolored or bloody sputum, accompanied by sharp chest pain that worsens with breathing. Conversely, bronchitis, which involves inflammation of the airway linings, generally leads to milder symptoms that include a cough with clear or white sputum and minimal systemic effects. It's vital to accurately identify these conditions, as their management strategies significantly differ.